Hello everyone, welcome to Naipanya Vikasam project channel. I am Chinnari, working as a functional English and life skills trainer in the project of Naipanya Vikasam. Today, I would like to teach you one of the topic from functional English class 10th. The topic is calling for help in an emergency. First of all, you should remember one thing, that is, in an emergency situation, call on 108 for an ambulance. Now, let us know about the conversation between the caller and call handler in an emergency situation. Call handler: okay, help is on its way. What's the problem? Caller: it's my dad. He has got really bad chest pains. I think he is having a heart attack. Please hurry. Call handler: okay, please keep calm. Help is on its way. I am going to ask you some questions, okay? Caller: okay. Call handler: how old is your dad? Caller: 72. Call handler: is he breathing? Caller: yes, but with difficulty. Call handler: is he conscious? Caller: yes, well, just about. Call handler: what happened? Caller: he didn't want to have any lunch. He said he felt sick. That was about 2 hours ago. And then he started having pains in his chest. Now they were really bad. Call handler: are you near him? Caller: yes, I am next to him. Call handler: tell him the ambulance is nearly there. It's just around the corner. So, in this conversation, the person who was 72 years old having a heart attack, it's an emergency situation. So, in the emergency situations, we may use first aid basics. In the first aid basics, the first one is DRSABCD plan. We can also call it Doctor's ABCD plan. Let me explain briefly about this plan. D for danger. Remove patient from danger. R for response. Check for response if patient is alert or unconscious. S for send for help. Call for an ambulance or ask another person to make the call. A for airway. Check for obstructions to airway, or is there any obstruction? Clear airway with fingers. Observe these two pictures carefully. B for breathing. Check if patient is breathing. If the patient not normal breathing, start CPR. And if the patient normal breathing, place him in recovery position and monitor breathing. C for CPR. The full form of CPR is cardiopulmonary resuscitation. Continue CPR until help arrives or patient recovers. D for defibrillation. It means uses an electrical shock to reset the electrical state of the heart so that it may beat to a rhythm controlled by its own natural pacemaker cells. So apply defibrillation if available and follow voice prompts. Next one is compressions. For adults, place heel of hand and lower half of breastbone in center of chest with other hand on top of first. Press down 1 by 3 depth of chest. Give 30 compressions and 2 breaths. For infants, place 2 fingers over lower half of breastbone. Press down 1 by 3 depth of chest. Give 30 compressions and 2 breaths. These are the two pictures for adults and for infants. And the next one is recovery position. So, in this recovery position, we have so many points. If you observe these three pictures, you may get the idea to keep the patient in a recovery position. First, kneel beside the patient. Place neither arm across chest. Place farther arm at right angle to body. Lift neither leg at knee so it is fully bent upwards. Roll patient away from you onto side. Keep leg at right angle with knee touching ground to prevent patient rolling onto face. Next one is choking. Choking means having severe difficulty in breathing because of a constricted or obstructed throat or a lack of air. For adults, encourage patient to relax, breathe deeply and cough to remove object. And for infants, if coughing doesn't remove blockage, call for an ambulance. And you may use techniques like bend patient well forward and give 5 back blows between the shoulder blades. And next one, if unsuccessful, give 5 chest thrusts in the CPR compression position, slower but sharper. If block is not removed, alternate 5 black blows with 5 chest thrusts until medical aid arrives. Next one is poisoning. In this, we have to follow DRSABCD action plan. Ring the Poisons Information Center on 131126. Monitor breathing and response. In this poisoning, the warning is don't attempt to omitting unless advised to do so by the Poison Information Center. Next one is burns. So, in this, the first point is remove patient from danger. If clothing on fire, stop, drop, and roll. Wrap patient in blanket. Roll patient along ground until flames extinguish. Second one is cool the burnt area. Hold burnt area under cold running water for 20 minutes. Remove clothing and jewelry from burnt area unless sticking to burn. And the next one is bleeding. In this, we have the 4 points. First one, remove or cut patient's clothing to expose wound. Second one, apply direct pressure over wound using sterile or clean dressing and pad. Third one, lie patient down and then raise injured part above heart. Fourth one, bandage dressing and pad firmly in place. And the next one is sprains and strains. For sprains and strains, follow RICE management plan. RICE, which means RICE. R for rest. The injured part should be in a comfortable position. I for ice. Apply ice packs on the injured part. C for compression. E for elevate means the injured part unless you suspect a fracture. And the last but not least, this is minor injuries. In this, we have three types of emergency situations. First one is nose bleeds. Second one is scraps and grazes. Third one is tooth knocked out. So, in these situations, we have to do first aid basics. For nosebleeds, sit up with the head slightly forward, pinch soft part of nose for 10 minutes. Breathe through the mouth, don't blow nose. Loosen tight clothing around neck. Apply cold pack to neck and forehead. In scraps and grazes, wash with running water to remove dirt. Cover with non-stick dressing, bandage or tape in place. In third one, tooth knocked out situations, clean with milk or patient's own saliva and replace in socket unless patient is a child under 7 years. Ask patient to hold the tooth in place. If unable to put tooth back, wrap tooth in plastic or store in milk or sterile saline and take patient and tooth to a dentist. If tooth has been in contact with dirt or soil, advise patient to have tetanus injection. So, these are the different types of first aid basics for different emergency situations. Thank you.